Thank you to Dr. Hernandez for the nice presentation. My name is Einas Abdulrehman. I'm a general dentist practicing in the city of Edmonton. I have been practicing for the last 12, 13 years. Mainly my practice focus on general dentistry, but recently I had some interest in orofacial pain. As Dr. Hernandez said, I joined a program and graduated with a master's degree in orofacial pain, oral medicine from the University of Southern California. I did that because I wanted to get more knowledge and more information to help my patients and their orofacial concerns. And definitely it was a very helpful step in my life. So starting with my first presentation, I'm going to talk about today is going to be the link between the oral and the systemic health. I chose this topic specifically because we know that the health of the oral cavity is not basically the health of the teeth. It has a big impact on the overall health of the body. And it is well known that oral health is connected to systemic health. But how deep is that connection? It could be surprising for many of us. It is far more extensive connection that we may think. So it is basically, it's linked to various bodily systems, and it will impact the health conditions for many diseases. And I will choose today some health conditions that we will talk about in depth. And this will include the diabetes, cardiovascular disease, and even the pregnancy outcomes. For us to achieve an optimal overall health, it is very important to maintain a good oral health. In today's discussion, we will shed a light on the emerging research surrounding the relationship between oral health and systemic diseases. And we will underscore the importance of oral hygiene as a cornerstone for a comprehensive health management. So let me start by asking the question, what is oral health means? So I get that a lot, and it does not mean basically a healthy teeth. Usually it will involve much more beyond that. It will include the health of the gums, which is basically the healthy tissues surrounding the teeth. It will include the health of the jaw bones, the ligaments, the fibers, and the nerves as well. All these structures are essential for performing a basic human function like speaking, smiling, tasting, chewing, and swallowing as well. So we all know that good oral health, it will not only contribute to an individual's physical well-being, but it will also impact the self-image and the overall sense of wellness. Being that said, it is very important to maintain an optimal functioning and appearance of the entire oral cavity to ensure a positive impact on the one's quality of life. On the other hand, we will say poor oral health, which is characterized by tooth decay, gum disease, inflammations, oral infections. It will not only deteriorate the physical appearance, but it will also significantly impact the overall well-being by potentially affecting the nutrition. It will impact the growth. It will usually negatively impact the self-esteem. And this will also, on top of all of these things, it will contribute to other conditions, which is going to be systemically seen as diseases like cardiovascular disease and diabetes. So the first systemic conditions that I'm going to try to talk about today, it's going to be diabetes and its link to the oral health. So as we all know, diabetes, it's a systemic disease that is affecting big portion of the society. We all know there is a growing number of people suffering from diabetes, and depending on different studies, 3 to 5 million Canadians today are suffering from either type 1 or type 2 diabetes, depending on a study done in 2022. In my clinic daily, I see people suffering from type 2 diabetes, but I notice a growing number of children having type 1 diabetes as well. So diabetes as a systemic disease, it will influence oral health. It will create a bidirectional relationship where each condition, each condition like gum disease can affect diabetes, and diabetes can worsen gum disease. So how would this work? Usually, poorly controlled diabetes, it will increase the risk for developing periodontal disease. And that is basically the risk for having gum inflammation and gum damage. And it is only described or maybe only explained by having high blood sugar level, which is seen because of the problem with diabetes. In the mouth, it will promote the growth of bacteria that will cause gum infections. These infections, in turn, can lead to more severe gum disease and potentially result in tooth loss. So it's a very unfortunate situation where somebody is having to deal with the symptoms of diabetes, will have problems taking good care of their teeth. Also, diabetes will have some blood vessel changes, and that will reduce the flow of nutrients and the removal of waste products from body tissue, and this will include the gums as well. With this happening in the body, there's going to be higher risk for infections. So maintaining good and controlled blood sugar level is very crucial in managing and preventing oral health issues. And this will highlight the connection of diabetes management and oral hygiene practices. Furthermore, the inflammation from periodontal disease, which is the gum inflammation, can exacerbate diabetes control by affecting the body ability to manage the blood sugar level. And this will be explained that the interconnection or the interaction will underscore the importance of comprehensive oral care for individuals with diabetes. And this will include regular checkups and thorough brushing and flossing. Also, we have to add lifestyle modification and careful diet selection. Plus, we have to talk about smoking cessation. So, with all this being said, preventative measure will not only support oral health, but also will contribute to the overall management of diabetes. And this will showcase the critical need for integrated healthcare approach that will consider the mouth as a window to the body's systemic health. And this is very important. Like when we talk about taking care of the oral cavity, it will help to have a better overall health of the body. And in this also, we need to focus on having kind of a multidisciplinary approach in managing those cases. So we need, with the doctor, we will need the dentist, and we need other practitioners to manage these type of cases. Moving on from the diabetes, well, I will talk about the second systemic condition, which is going to be the cardiovascular disease. This is another systemic disease that is also affecting big number of people in the society. Every year, we have an increasing number of people having cardiovascular diseases. We notice that it's the second leading cause of death in Canada. And according to recent studies, about 2.3 million people suffer from a form of cardiovascular disease today. The link between the oral health and the cardiovascular disease, it's getting increasing scientific focus. It will getting more attention recently, and it will underline the critical aspect of preventative measures in that aspect. So periodontal disease, which is again, I'm talking about the term periodontal, but I mean the inflammation of the gum which is characterized by gum inflammation, destruction of the bone, and the tissue supporting it, have been identified as a risk factor for cardiovascular disease, which include, but not limited to, atherosclerosis, heart attack, and stroke. So when we say that there is a link, what's going to be the mechanism behind it? So simply the mechanism behind this association, it has multi-phase, but we are thought to involve a systemic inflammation, which is initiated by oral pathogen. We have specific type of bacteria in the oral cavity that when they are involved in the destruction of the tissue supporting the teeth and the bone, they can have an access to the bloodstream from these diseased gums. And this, once they will get into the blood, they can contribute to the formation of arterial plaques, and this will promote atherosclerosis, which is a leading cause of cardiovascular disease. When we are talking about this will highlight the importance of maintaining good oral hygiene, not only to preserve and have a good health for the dental tissue, but as a preventative measure from those systemic conditions. Usually, science and research have been showing that individuals with poor oral health, particularly those having a periodontal disease, they are at higher risk of developing heart conditions and cardiovascular problems. The inflammatory process associated with the gum disease may show through research that there is a higher number of inflammatory cytokines and C-reactive protein. And this is basically science talking here, showing that when we do tests on those patients, we will see that those patients have higher number of those inflammatory cytokines that will be kind of a causing factor in their heart conditions. Moreover, just to make it complicated, the impact of the periodontal disease on the control of the blood sugar level and also for the contribution and the development and the progression of diabetes, it will further even more complicate the cardiovascular problem. So this interconnection between the oral health and the heart health, it will emphasize the need for the integrated care approach that will consider the dental health as a significant factor in cardiovascular disease prevention and management. So again, when we are having somebody suffering from bad gums, they are at higher risk for having cardiovascular disease. But if they have diabetes as well, this will make them at higher risk by double, because we have the problem that is happening from uncontrolled blood sugar that can cause some damage in the arteries, and they already have bacteria in the bloodstream, so the situation will not be good. So a preventative measure will make definitely life easier for those patients. So moving from diabetes and cardiovascular disease, I wanted to talk about what's going to be the link between oral health and respiratory infection. So this connection between the health of the oral cavity or the health of the mouth and the respiratory infections that we can see is grounded in the understanding that the mouth will serve as the primary entry point to the respiratory tract. And this is very important understanding that we are seeing today. And we will all realize that poor oral hygiene can lead to the accumulation of pathogenic bacteria. And if it will be aspirated into the lungs, it will cause serious infections that could lead sometimes to pneumonia, and it can sometimes exacerbate conditions like chronic obstructive pulmonary disease, COPD. Again, this relationship will highlight the critical role of maintaining good oral health in preventing respiratory infections. And this will emphasize the need for regular dental care and effective oral hygiene practices. Science and research have been suggesting and have been showing that treating periodontal disease can lead to improved respiratory health, particularly among individuals with pre-existing respiratory conditions. And this is simply done by reducing the oral inflammation. We will work on cutting back the number of bacteria and the bacterial load in the oral cavity. And if this has been done, this will reduce the risk for those pathogens to be aspirated and subsequent lung infection from happening. These findings will underscore the importance of the interdisciplinary approach in the health management of those cases. So when we are talking, let's say, about a patient having a respiratory disease management, it's going to be really effective maybe to have an oral practitioner or a dentist to be a part of the team. And it's going to be really nice if we can work on the preventative strategies to help in controlling those respiratory problems. So by addressing oral health, healthcare providers can contribute to the reduction of respiratory infection risk, and this will illustrate the vast interconnection of oral and systemic health. Next, I would like to talk about pregnancy outcomes and the health of the oral cavity. So I get that question a lot. What's going to be the impact of pregnancy on the health of my gums, and how can problems in the oral cavity impact my baby? So pregnancy, as we all know, it will introduce significant hormonal changes that can affect oral health. It will increase the susceptibility to gum disease and periodontitis, and make there is going to be higher risk to get cavities as well. Nearly 60 to 70% of pregnant ladies, they will develop what we call gingivitis, which is an early form of periodontal disease that we can see in the dental chair, characterized by swollen gums, inflamed gum surfaces, easily bleeding, and sometimes teeth sensitivity. If you don't treat gingivitis can become worse, and it can progress to something called periodontitis, which is a leading cause of tooth loss, and it can affect pregnancy outcomes as well. This has been seen as causing factor for preterm birth and low birth weight. This inflammatory response during pregnancy can exacerbate the oral conditions. And again, I have to say, we have to highlight the importance of enforcing oral health during pregnancy time, to make sure that the health of the mom and the health of the baby will be good. And it's not only about the pregnant woman, it's about the health of the infant as well. Furthermore, pregnant women usually will show some changes in their diet, which will obviously seen by increased consumption of cavity-causing food, increased intake of daily sugar. So this will risk, they will put them at higher risk of developing dental cavities and dental caries, which is, if not managed properly, and if it will not be treated, it can affect the oral microbiome very badly. Why we are talking about this? Because if the mom is having this kind of bacteria in the oral cavity, it can be easily transmitted from the mom to the baby, and this will predispose the newborn to something called early childhood cavities later. And this will emphasize, again, the need for maintaining good oral hygiene and regular dental checkups during pregnancy. So oral health during pregnancy is not about dental health. It's a very crucial aspect for a prenatal care, and that can have a lasting effect on the mom and the baby. And I just want to highlight something here while I'm talking about the importance of regular dental checkup during pregnancy and the health of the newborn and the health of the dentition for the kid. I always advise my patients that please don't share any utensils with your newborn. You can easily introduce your newborn to those kind of bacteria that will badly, that the baby will suffer later. So when a newborn is coming to the world, usually they are sterile. They have no bacteria in their oral cavity. Please try not to introduce those bacteria by doing something like, sharing maybe like, a utensil or something like that. And that's all about pregnancy and oral health. I would like to move now to oral health and rheumatoid arthritis. So we all know that rheumatoid is one of the inflammatory diseases that is causing some symptoms and causing some pain in the joints, but how it could be connected to the oral cavity and how we can link having a good oral health to improve symptoms of rheumatoid arthritis. So the interconnection between the oral health and rheumatoid arthritis, it will highlight the broader impact of oral conditions on the systemic inflammatory diseases. So again, periodontal disease, it will share some pathogenic mechanism with rheumatoid. It will include the dysregulation of the immune response and the role of the inflammatory cytokines. So if somebody is having periodontal disease, this can exacerbate the symptoms of rheumatoid arthritis, suggesting that the oral bacteria and the ongoing inflammation can contribute to the severity and the progression of the rheumatoid arthritis symptoms. This relationship again highlights the importance of comprehensive oral care in individuals suffering from rheumatoid arthritis, as managing the periodontal health can show a remarkable impact in managing and improving the symptoms of rheumatoid arthritis. Furthermore, we can say that the oral cavity is basically acting as a reservoir for the microbial pathogen that can trigger systemic inflammatory response, and this will impact diseases like rheumatoid arthritis. Research has been working on suggesting that improving oral health through regular dental care and hygiene practices can lead to a better management and possibly a reduction in the risk of developing rheumatoid arthritis and even controlling the symptoms, which is going to be really helpful and getting a patient to have a better daily life. After discussing the link between those systemic conditions and the oral health, I would like to talk generally about management and prevention. So to prevent and manage oral health effectively, a comprehensive approach is essential. Talking about this, we will start by saying regular dental checkups are really important. By doing this, you will allow dental professionals to perform necessary cleanings. They can easily identify early warning signs of problems, and they can give you a good advice and how to be able to help you to maintain good oral hygiene. On a daily basis, I see my patients and I sit and spend good time talking about oral hygiene practices. Patients are encouraged to brush at least twice a day. This is very simple, but it's very important. And the earlier it will be implemented in children, the better impact it will be showing in their life. Every day, twice a day, at least 2 minutes. Like usually we underestimate the time that we will spend using the dental or using the toothbrush, but usually 2 minutes is really a good time to spend using a soft brush. You don't need to use something hard. Sometimes it's nice to have a fluoridated toothpaste. It will be a key ingredient that will be added to the toothpaste that can make it more effective. It will harden the tooth structure. It is usually safe if it is used as directed. So yeah, brushing is very important, and it's a really a vital, like it's a very vital step in home care, and like the result is definitely something like, it's easily seen for people who will take it seriously. Talking about prevention, there has been lots of research done over the years, thousands of studies that showing that adding fluoride to the water, it could be helpful in preventing cavities. It has been shown to be safe for children and adults. And usually if it will be used according to the recommendations, which is going to be the target range between 0.6 to 1.1 milligram per liter, and depending on the area and the climates. We talked about brushing. What about flossing? Definitely flossing is highly recommended. It's as important as brushing. We use the brush, and we said it twice a day. It's important to remove the food, or let's say the plaque from the tooth surface that we can reach with the brush. But the floss will reach where the brush will not be able to access. And this is very important. There's going to be lots of research has been done on the use of the daily floss, and it's shown to be very effective in preventing gingivitis. It will get you to have healthier gums, less bleeding, and definitely using the floss, it will prevent cavities from forming between or let's say back-to-back cavities from forming. So definitely flossing is very important. People sometimes like to use the mouthwash, and it's definitely will offer an extra protection by reducing the plaque, and it will help to also reduce the gum disease. It will give you that kind of a refreshing feel at the end, and people like sometimes to use different flavors. It's up to you, but definitely mouthwash can be helpful as well. Moving to diet. When we are talking about prevention, diet is very important. It will play a significant role in oral health. When we are talking about diet, we will definitely talk about sugary stuff. So limiting the intake of sugar, sugary snacks, sugary beverage is highly recommended. And when we talk about this, I talk in general, but for children, it's very important. We have been seeing an increasing number of cavities among younger generations, and it's very important to educate in terms of diet options. There is too much consumption of sugary drinks and beverages. Water will be really nice. They can maybe use water after drinking something like that, but definitely limiting the intake will be very important. Moreover, smoking is very bad in terms of the oral health. If you are talking about the health of the gums, smoking could be really bad. Having kind of a delay in the way that the gums will heal if you're a smoker. So smoking cessation is very important. And usually we sit, we talk with our patients, we educate them about the harmful effect of smoking. If they need help, we can help sometimes with some alternative options, like patches or stuff to help them take that step. So again, educating the patients about these practices can empower them to take a proactive step towards preventative oral, towards those preventative measures and how to control the oral disease and to maintain a healthy mouth. When we're discussing those kind of links between the diseases we mentioned, there is today more research coming out talking about having more connections that we see today with other diseases that we did not know about before. And this, for example, there is a growing interest in exploring the relationship between oral health and conditions like Alzheimer's disease and certain types of cancers. Studies are investigating how periodontal disease and the oral microbiome might influence or may be linked to the development of these systemic conditions. So as a final message, when we recognize that the oral health, it will extend beyond the confines of the mouth, and it is deeply interconnected to the overall systemic health, it will make a key understanding in the healthcare system as a whole. This introduction, it will pave the way for an in-depth examination of both established and the emerging research on the relationship between the oral health and systemic disease. It will emphasize the critical role of maintaining good oral hygiene, not only for dental well-being, but as a fundamental aspect for a holistic health. So by exploring this connection, the discussion will advocate for integrated approach to healthcare, where oral health is considered as a key component for maintaining and enhancing overall health and well-being. And yeah, that's it. Thank you so much. I hope that was kind of valuable, and I will be there for any questions